No more brain cancer. Brain cancer can be divided into primary and secondary. Primary brain cancer refers to a malignant tumor that originates in the brain. It is usually named after the primary brain cells. The most common one is glioma. For example, astrocytoma is caused by the degeneration of astrocytes. Secondary brain cancer is also called brain metastasis. As the name suggests, it refers to a malignant tumor in other parts of the body that spreads to the brain through the blood. The more common cancers that metastasize to the brain include lung cancer and breast cancer. Secondary brain cancer is more common than primary brain cancer. Depending on the different brain functional areas where the tumor grows, different symptoms will be manifested. If it grows in the frontal lobe, there may be personality changes, dementia, or laziness and lack of motivation. If it grows in the temporal lobe, it may show hearing abnormality and memory loss. If it grows in the parietal lobe, it may cause abnormal movement or sensation. If it grows in the occipital lobe, it may cause visual impairment. If it grows in the cerebellum or posterior cranial fossa, it may cause unsteady gait and imbalance. The symptoms of brain tumors can be divided into 4 categories: increased intracranial pressure, epileptic seizures, systemic disorders and local neurological dysfunction. 1. Increased intracranial pressure. Common clinical symptoms of increased intracranial pressure include headache, vomiting, visual impairment and consciousness impairment. 1.1 Headache. Generally dull pain, coughing, sneezing and going to the toilet will make the headache worse. Early headaches usually only occur when getting up in the morning. In the later stages, headaches will persist and become increasingly severe, and medication often cannot relieve headaches. 1.2 Vomiting. Vomiting caused by brain cancer often comes suddenly and violently, jet-like, and is not necessarily accompanied by headaches and nausea beforehand. 1.3 Visual impairment. Patients may experience blurred vision and double vision. 1.4 Consciousness impairment. It is caused by reduced blood flow to the brain and affected brain stem function. If a brain tumor grows rapidly, it can cause brain edema, and the patient may go from conscious to coma in a short period of time. 2. Epileptic seizures. Epilepsy that occurs in adulthood should first be suspected of brain tumors, and a detailed brain examination is necessary. Almost any type of epilepsy may be seen in patients with brain tumors, including localized or systemic epileptic seizures. 3. Endocrine disorders. Endocrine disorders cause abnormalities in growth, body shape, and sexual function, such as jauntism or acromegaly, infertility, and menstrual disorders caused by pituitary tumors that can secrete hormones, or symptoms of low hormone levels due to the pressure of brain tumors. 4. Local neurological dysfunction. Patients may experience local neurological symptoms, such as weakness or inflexibility of one side of the limbs, abnormal body sensation on one side, unsteady walking, difficulty in speaking, temperament change, visual field loss and localized epileptic seizures.